in safeguarding, I slightly changed the there we go, the name.
We can see that, Becky.
I'm really sorry, I'm trying to get there. No, I'm trying to get my notes page up. This is the first time I've done anything like this, so I'm going to apologise. There, I think that's it. So thank you very much for inviting me to come and talk to you. I am the Deputy Manager to the Norfolk Safeguarding Adult Board, or NSAB, which is a bit quicker to say. My background is in adult social care, and I joined NSAB in March of this year, having spent 10 years as a safeguarding adult practice consultant in Norfolk. So I've mainly worked in the south and the east of the county, but it's actually really nice. I've seen a few familiar names that have joined the meeting today, because part of what I particularly enjoyed in safeguarding was working with providers, and a lot of that was around what I was thinking was prevention and partnership. Excuse me. So thinking about prevention and partnership, essentially they're 2 of 6 safeguarding principles that we use to underpin all our safeguarding work. This is a bit of a whistle-stop tour, I should say, so bear with. So just going over things quite briefly. So the 6 safeguarding principles which are set out in the Care Act guidance. So we have empowerment, which is about person-led decisions, people being asked what they want to happen, and what those wishes forming the basis for safeguarding intervention. Prevention, which is obviously a massive one, which is about let's take action before harm actually occurs. And this is about making sure people get clear and simple information about what abuse is, how to recognise the signs, and what they can do to seek help. Proportionality, another big favourite of mine. This is about the least intrusive response, the most appropriate response to the risk that's actually presented. And for me, this links with accurate risk assessment. So it's the old, not using a sledgehammer to crack a nut. And I think, again, this should be a really sound basis for safeguarding or indeed care intervention. Protection, support and representation for those in greatest need. So this is about people getting the help and support they need to report, to recognise it, and to be able to take part in the safeguarding process as much as they want or are able to. And then partnership. This is about local solutions through services working with their communities, giving people confidence that essentially professionals and services are going to work together to get the best result for them. And finally, accountability. So essentially, transparency and accountability in safeguarding, so that the person understands the role of the people involved in their life, and also that professionals and service providers know the roles that we're playing. So it's very important that, these are the principles that really underline what the board does, what safeguarding does, and to an extent what care does. So the other big thing that the board gets involved with is commissioning safeguarding adult reviews. So these are a bit like serious case reviews for children. They're still new-ish in the adult world, but it's something that all safeguarding adult boards are expected to commission and look at. And essentially, they give us an opportunity to learn lessons where abuse or neglect is suspected to be a factor in the death or serious harm of an adult who has care and support needs. So as we're getting more and more reviews that we're looking at, and there are a number in Norfolk that we've published, and there are more on our website with the link at the end. There are very clear key themes that come out of these, which we've just put out there, and I doubt any of those would come as a surprise to anybody. So we've got professional curiosity, that's about actually asking that question, having a bit of a deeper look, actually asking for evidence if someone's telling you something. Places where people can have discussions, share information, collaborative working decision making, so we're all taking those decisions together, not leaving people out in the cold. That accountability, again, taking ownership of what happens and knowing what's going on. And right through all of these, it's about the lived experience of the adult. So the making safeguarding personal. It's making sure that we really understand the experience of that person, what they want, consider capacity. And you can see along the bottom, we've got that managing risk, uncertainty and mental capacity. So these are all kind of themes which come together and are telling us that we need to be making sure that we're doing this when we're undertaking safeguarding work or we're supporting people. So in Norfolk, we published 2 SARs in January of this year. They're called SARS F and G. So again, they are on the website. Both involved older people in residential care presenting with behaviour that challenged others. Now, there's a lot more to these SARs than what I'm going to talk about here, obviously. So it's quite interesting to read, and it certainly is about how all parties needed to work together better. I guess that's the thing about the SAR process, the safeguarding adult review process. It's not about apportioning blame. It's literally about looking, where did things go wrong? Where could we have done better? And what can we change to make it better going forward? So some of the things from the SAR, for example, was there was talk about unpredictable behaviour, but no evidence that anyone had actually really tried to understand what that behaviour was or the triggers for it. There was no mapping or limited mapping of behaviour, no ABC charts, limited detail in records available. One of the other interesting things from these was that these individuals were assaulting other residents, but also staff. But that wasn't clear until I think the review happened, and it was sort of looked back at, and meant that the picture wasn't complete. So I guess it's a reminder to say that just because staff being here isn't a safeguarding, doesn't come under section 42, don't have to report it, it's still part of the wider picture and helps us to understand intensity, frequency, might support looking at what triggers for behaviour are. So it really doesn't mean it's not important, simply because it doesn't come under that specific section 42 safeguarding umbrella. One of the other things that was noted from these was about a level of dependence on medication to manage behaviours, and thinking back to our sort of proportionality and mental capacity, is medication really the least restrictive offer? Thing to do, or actually do we need to be looking at other ways of supporting an individual first before we go straight to the medication option? And I say, and that's talking to GPs and health professionals as well. It's asking everybody to look at that. Another example is the blanket use of saying we'll put 1-to-1 in, but actually 1-to-1 is incredibly restrictive for the individual. It's very labour intensive for the carer. It's very expensive for anyone who's paying for it. And a lot of the time it can actually provoke the person more. So these SARs were telling us to try and look at things in a bit of a different way, and essentially to try and understand that behaviour a bit better. One of the other bits from this was that one of the cases actually seemed to resolve when looking back at it with hydration and treatment of an infection, but that was only after a series of moves between services and acute hospital and psychiatric settings. And part of that was about the difficulty in getting that professional coordinated support around the individual and somebody moving from place to place. So these really sort of pinged up quite a lot of things for us, but in terms of talking to you today, I felt that one of the most important learning points was about how important it is to have that coordinated support and collaboration. It's not just necessarily in safeguarding events, but just generally where adults have very complex care needs. And this applies to all adults in all settings. And fundamentally, working together in a multi-agency way means that we work in partnership to prevent harm. So thinking about the expectations on you, and there are obviously certain expectations, and I suppose this is something just to kind of go over the things that yes, there's no doubt, people will come and say, have you done X, Y, and Z? So there is an expectation that staff will have a good understanding of their duty of care, of the Mental Capacity Act. you know, 15 years on, and understanding is still very variable across services, and us would say some, you know, some professionals. So we're still, as a board, really pushing mental capacity training and that understanding. One of the interesting things about training, so the next one's about providing good training and support to staff. Think about how you check the impact of your training. So it's very difficult at the moment. We're all doing everything online. But think about how you actually assess competency. How do you make sure that, you know, the 5 staff that have sat in front of a screen and done some e-learning, think about how you actually check that learning, and perhaps not just a week after, but kind of 6 months on. Think about how often people might need refresher training. I've said here about supervision. You know, supervision is sometimes, you know, a quick win if people haven't got time to say, oh, we'll do that, you know, another day. But actually, it's that opportunity to have discussions, talk through, you know, what's been going on, any concerns. From a prevention point of view, from my perspective, it's good because you're able to, you know, assess, you know, some simple things like how are things generally, how are the people, staff coping. Are they getting very stressed for any reason? Have you got somebody that's got a real interest, for example, in pressure care or some aspect of care that you can make them into a champion? Those supervision sessions are really important and make your staff feel valued. It's very important, obviously, to have up-to-date information on the people you're supporting. I lost track of, you know, the number of cases that I was involved with where things had changed and the paperwork hadn't. I genuinely, having spent a lot of my time looking through care records, get the fact that our care records become unwieldy and unmanageable. Even electronic systems, you know, they're still kind of massive. So I guess it's about remembering what are the real vital things that I need to make sure I've got in a place that everybody can access if they need it. You know, so that if you've got a fast changing health scenario, for example, how do staff keep up to date with what's going on? Documentation and review. So again, that's about if there is a change, perhaps actually taking the time to look and see whether there's anything else it might link with. So the obvious one is obviously behaviour. So if you've got a change in behaviour, it's very usual to think about a UTI perhaps, but how many people think about constipation? How many people think to look at food and fluid? Because sometimes for people with dementia, it's, you know, can be hunger or thirst. A lot of the time they don't even know, you know, they won't be able to tell you. Have you had a change in carer? Has there been a change of routine of some description? So it's always worth starting just to have a look at what's going on that you already know. And it's also important to have strong quality audit processes. So being able to recognise quickly where changes need to be made. And the most important part about that is making those changes. There's no point doing audits and having tick boxes where you've actually identified an issue and then not making the change. You need to have that follow through. So it's kind of review, change, review, and seeing what's going on. I wanted just to put in a very quick reminder about DOLS as well, because deprivation of liberty safeguards, I think people have been sort of, you know, obviously waiting for the liberty protection safeguards to come in. Implementation is now delayed until April 22, I think. I might have got that wrong off the top of my head. But just remember, if you've got a DOLS application in already and things change, let the local authority know. If you have an urgent application, let them know. Just because there is a bit of a waiting list, it doesn't mean that if you have an urgent need, they will absolutely respond. So potential barriers. This was me thinking about the providers I've worked with for a long time. So this is just, you know, some of the things I kind of pulled out that I figured sometimes you may well feel. So this is thinking about dealing with people that have really complex, perhaps behavioural issues, and, you know, you're trying to manage and really not quite knowing what to do next. So some of the things I've come across in the past are very clear feelings that as a provider you're expected to cope or to manage complex issues alone, and that you're failing if you're asking for support. You may be concerned about criticism or judgment, you know, of your service. And probably the biggest one that I've come across is frustration that no one's listening, and that when you do ask for support, that nothing changes. So the thing is, working in partnership with people and having genuine relationships and good communication with the people around you and the agencies and professionals around you can really help with this. Essentially, if you have better communication, you have better understanding, you know where each other's coming from, you have that trust. It makes it so much easier to work together, it reduces conflict, makes it easier to have helpful conversations rather than battles with people. And it's very, very, you know, we all put our hands up. Professionals don't get it right either. Professionals work within constantly changing systems like the rest of you with very limited resources and can get just as defensive. But it's back to understanding each other and having those conversations. So thinking about partnership in terms of prevention, and why is this prevention? Because fundamentally it is very likely to stop problems escalating to the point that particularly safeguarding occurs or that harm occurs essentially, and provides a better experience for the individual.
Becky,
yep.
Sorry to interrupt. We're sort of at the last 5 minutes. Is it possible to sort of wind up?
There's only this and one more.
Perfect. Thanks, Becky.
No problem. Okay, so this is about the right people being involved at the right time. Yes, so how do you communicate changes within your staff group? So thinking about how many staff safeguarding referrals have been raised because visiting professionals have asked a staff member a question they can't answer, and you know the information's there, it's just that they didn't. Keeping the individual involved, making safeguarding personal and family members where possible. Again, safeguarding referrals come up because a family's not told about a fall that happened a few days ago and they visit and see huge bruising. Ask the families what they want to know and when, and document it. Involving GP and community health team early on because of any physical factors. Using links obviously with our amazing quality assurance teams that are now Norfolk County Council and CCG, so much experience and knowledge and support and guidance out there, and they are really there to help and support. It's very important to make sure you have accurate details of any professionals involved. A social worker may close a case, so just make sure you've got those sort of details up to date. Be really clear about what you've already tried. If you're looking for a mental health act assessment or mental health referral, you have to have made sure that any possible physical causes have been ruled out, and that will sort of cut through. Essentially, it makes it easier for the person you're talking to identify what support. So it's about creating the partnership around the person. So very quickly, what else can you do? Keep on using the amazing NSCS for additional advice, guidance and support. Keep your safeguarding awareness high, and have a look at our website. There's lots of information about training, guidance, things that we've written, and also follow us on Twitter if you wish to. There you go, me done.
Thank you, Becky. That's absolutely brilliant. Thank you, and well done for getting that in time. Fantastic. Well done. If that's your first time, well done. That was really good. We've got a thank you, Becky, coming in on the chat box here. Just to confirm, you are right, it's April 2022 with the LPS that is delayed, although they do say some provisions covering new roles and training will take place prior to this date. So that's the latest. Is there anything that anybody would like to ask Becky about at all from everyone that's here today? If you want to put your hand up or put something in the chat box, or even be brave enough just to take your microphone off and ask a question, please go ahead. I'll leave that available for you for the next 30 seconds or so. We've got lots of thank yous, by the way, Becky.
That's lovely.
In the chat box. From Lindsay, from Raj, from the Windmill, from Stephen Long, Alex. Oh, Raj, go ahead, Raj.
Hi, Becky. I just want to know, how do you deal with the, when somebody just phones up the safeguarding people that, there's an issue here, right? How do you deal with those things, right? Because sometimes people just do it.
Yeah, you mean yes. I mean, unfortunately, you kind of can't prevent. There will always be the family member that you sat with for 3 hours explaining what went on, who will come back and ring safeguarding. You will always get the professional, the paramedic that comes in at 3 o'clock in the morning and comes away and makes a phone call. But I guess it's about if you actually have good relationships with your own with your the nurse that visits on a regular basis, or social workers that come in, or mental health, if you've got those positive relationships, I think it gives you almost a security or a confidence in being able to step back and go, look, okay, yes, that happened on that night perhaps, or we accept that something hasn't gone quite right, or actually it was all in place and here's the evidence. It's often about being able to have the confidence that your service has actually done everything that it should do. Or I was always very, very happy if a provider went, do you know what, we did that wrong. We absolutely did that wrong, but do you know what, this is what we've put in place to address it. Fine, because there is nothing that goes perfectly. So I can't, we will never stop people picking the phone up and making all sorts of allegations, but in this sort of way, if we're clear about what we've done, it gives you that confidence to be able to go, do you know what, it was fine. This is what happened.
Okay, thank you. Thanks, Becky.
Pleasure.
Thank you, Raj. Okay, so I don't think, was there anything else in the conversation? No, we just said very helpful, good clarity. Thank you very much. That's Michelle and Sunita. So thank you, Becky. You're very welcome to stay till the end if you wish to do so, or leave if you wish. You're very welcome either way. Okay. So we're on to the next person to present, which is Josh Townsend. Sarah, is Josh about? I can't see him in the... Oh, Josh. Hello, Josh. Oh, welcome, Josh. Welcome.
Thank you ever so much. A bit like Becky, this is the first time I've shared anything, so just bear with me a second.
Oh, that's okay, Josh. Well, I'm sure you'll be fine. Oh, look at that.
Can you see that okay, everybody?
I can see it. Yes, yep, absolutely.
Lovely.
Josh, in the same way, are you happy? Would you like to just go straight through yours and then we'll take questions at the end? Would that be okay?
Yeah, yeah, of course.
Okay.
Of course.
And people, if you just want to put your hand up or put chats in the box as usual. Thanks, Josh. Away you go.
No problem. Well, first of all, thank you for having me. So just to kind of introduce myself, my name's Josh Townsend, so I'm one of the quality monitoring officers at Norfolk County Council, and so kind of I just wanted to give you kind of a real whistle-stop tour of the team and the changes that are going on in the team at the moment, given obviously the new normal that we're facing at the moment. So currently the team has a structure which is on the slide there, which consists of a head of integrated quality, which is a gentleman called Tim Weller, 8 quality monitoring officers, 4 quality improvement nurses who specialise in training and advice, and then we also have 1 business support officer. We are now in the process of, we have recruited 1 new senior quality monitoring officer, who is a gentleman called Stephen Long, who I think is also on the call today. I don't know if Stephen wants to quickly introduce himself.
Thank you, Josh. Yeah, can do quickly. Yeah, so I'm the new Senior Quality Monitor Officer at Norfolk County Council. So I'll be managing the quality monitoring officers. This is my 2nd week, so quite new to the role. But I come from a wealth of background, a wealth to work organisations. So really looking forward and to start working with the quality monitoring officers. I'm very lucky, a very good, strong team. What I've seen to date. So yeah, that's me. Thank you, Josh.
No problem.
Thank you, Stephen, as well. We've emailed each other, so it's nice to see a face to a name. So yes, thanks, yes, Stephen. Yeah. Thanks.
No worries.
And as well as Stephen, we're in the process of recruiting 4 new quality monitoring officers on a 2-year fixed contract. The reason for that is that obviously with the challenges that I'm about to explain, our workload has sort of grown exponentially as we try and support the system through ultimately is one of the biggest challenges I think it's ever faced in my sort of 10 years in adult social care. So in the new world, obviously, as we move sort of virtually, a large amount of our time has been sort of supporting services remotely. We've been looking at care plans. Some of our providers have given us sort of electronic access to their care planning tools. And this can be done remotely, and we can have a limited time access. So it's something that we've really encouraged, particularly where we've been doing sort of virtual visits, so that we can review a couple of care plans and give that support to the system. Obviously, we've been trying to sort of undertake regular reviews of action plans and undertaking regular sort of phone contact with our services. I would hope that the majority of the services here have had at least one sort of phone call from their quality monitoring officer, you know, to just sort of check in really, and just to make sure you're okay, and B, just to explore if there are any challenges. As we move sort of further into the kind of new normal, we're undertaking now what we call virtual quality monitoring visits. So we've done quite a few of these, and they seem to be working quite well. We've had some really positive feedback. So they generally undertake sort of a one-to-one discussion with the manager and deputy manager. We'll then look at any concerns they might have, any outcomes of safeguardings, and then we'll also undertake a virtual walkthrough of the home, speaking to residents and staff members if they're willing to discuss. I think it's also really key for us to maybe get the opportunity to speak to staff members away from the quality monitoring visit if they're happy to do that, just to see if there's any learning or further support that we can provide. Like I say, I think, you know, please, if you do have a virtual quality monitoring, please provide us some feedback on that. You know, it is ultimately something that's really new to us. We're quite used to sort of doing these things face to face and sort of coming to visit, but ultimately what we don't want to do at the moment is increase that footfall through your home unless it's absolutely necessary. Obviously, there will still be times where one is needed, you know, where actually crossing the threshold is really the best answer in order to get the answers that we require, and also to fully ascertain the support that you as a service need. So sort of the next kind of area that we've really had to work on quite hard since the COVID-19 outbreak is areas where we've supplied PPE. So back in March, obviously, there was an acute shortage of PPE, and as a local system, we made the decision to step up and support services, particularly with procurement of emergency supplies. This has obviously very recently changed. So on the 27th of July, it moved to a new kind of distribution model to try and ensure that it was sustainable for the long term. You know, so please, if you've got any questions on that, I'm happy to take them away and come back to you sort of outside of this forum to discuss those. We've also been undertaking support with Public Health England and looking at how we can support them to manage COVID-19 outbreaks in care homes. So we've been providing that advice and support, regular catch-ups. You know, prior to obviously testing being rolled out, we were providing support around ensuring that, you know, isolation was in place, ensuring stocks of PPE were there, and any kind of general real emotional support as well. I think it's important to recognise the emotional toll that this period has taken on managers and your care staff. And what we wanted to do was to kind of provide a holistic support package as best we could to the system and yourselves. We've also been supporting the incident rooms, so the CPIR, and where that information has come through, we've been looking at tracking test results, arranging swabbing, whole home testing if required. Our quality improvement nurses have been supporting with infection prevention and control training, but also they recently rolled out the new respect training as well, alongside training for things like I Stumble and any real sort of support packages. So again, there is an email address at the end of the slides, which I'm happy if you've got any queries along those lines, if there's anything that you would like to know, please, we are here to support you as a system, and we're happy to do that. The challenges that COVID-19 bring can't be underestimated. So I've picked out kind of a few really. The first one's really around the challenges of isolation versus doles. So that particularly focuses in around obviously those residents that lack capacity, who may walk with purpose, and how you manage those and the challenges that they bring. So a lot of the support we've been providing is looking at cohort isolation strategies. Is there a way that we can reduce their movement within a home without restricting them, that's going to cause some behavioural difficulties or escalate any situations for other residents? Again, like I say, if you've got any questions on that, please do ask. One thing that we have noticed, which I think is worth noting, is that we've seen a decrease in our kind of low-level safeguarding alerts through this period. So things like medication errors, falls, those sorts of things. And it might be that obviously they have decreased, but I think one thing that we obviously have identified, and I think given the challenges it's fair enough, is kind of a reduction in your kind of business as usual activities. So please do refer those in where they're identified. I think it goes back to what kind of Becky was saying in the last presentation, that actually we're here to support, and we're happy to provide that support where needed. Obviously, the biggest, I think, change that we've seen over the recent months is the testing and the changes that have come with testing, and the challenges that brings. I'm sure after this presentation I will get one or two questions on that. The only thing that I would urge you to do is to continue to use the local testing arrangements where you have symptomatic residents specifically, and we can support you with that, and we can ask the local swabbing team to come out and support yourselves. And finally, on kind of COVID-19, again, I've said it a couple of times, we really do recognise the challenges that COVID-19 brings to yourselves. So please use the support that is out there. The email address there for the CPIR is the best route, really, because that will get triaged down to the most relevant person, and then we can provide you with advice and support. Some final thoughts from me on the presentation really are, do remember that if you do find yourself in urgent need of PPE, we are here to help. And please do check our dedicated COVID-19 web pages. So I should have put the link in the presentation, but what I will do is I'll put it in the chat once I'm done for everybody here. So on there, it gives you kind of quite specific local advice, particularly around things like visiting, local PHE guidance around sort of visiting, local testing arrangements, advice on staff, lots of questions and answers really for you. But again, there are all the contact details on there. And finally, I think, to end on a really positive note, the one thing that I think as a team we've really identified is that actually the COVID-19 outbreak has really helped us to form some really positive relationships with our care providers. It's taken us to homes that otherwise we may not have had contact with, and we want to sort of build those bridges with care homes. And I think the outbreak has allowed us to do that in terms of sort of making regular contact with everybody, and like I say, just starting to help people to provide good quality care. And if they've got any questions, just to know they can come to us and ask them, I think is, for me, the biggest thing really. One final thing, a bit like Becky, please do follow us on Twitter at Quality Norfolk. There you will get kind of the most recent sort of updates. We don't tweet particularly very often, but what we will tweet out are important updates that providers need to know. That's it really.
Thank you, Josh, and you've managed to do that in your time slot. So thank you very much indeed. So really over to you guys. Have you got any questions? We've got something in the chat box here. Do you use the NHS tracker to audit home needs, Josh?
Yes, so if particularly around things like PPE, so we don't have access to the tracker ourselves, but if there are particular concerns, then we do get alerted to those to ensure that we can provide the right support.
And we've got a question here from Zach. May I ask, what are the preparation plans of NCC for a possible second wave of the COVID-19? Is a review of COVID-19 response conducted, and any lessons learnt communicated to the providers, please? Thank you.
Obviously, I don't know if Stephen can give a more sort of managerial sort of answer to that, but from me, I feel that we are learning. We've learned a lot in terms of ensuring that we can get a response out there. Obviously, in terms of things like the testing team are now up and operational. The PPE supply is there for the long term now as well, and the support that we're able to provide with the extra staff members is going to be helpful, and hopefully I feel that as a system we are better prepared for a second wave than we were back in sort of March time. Stephen, have you got anything to add to that?
Yeah, thank you, Josh. I just second what Josh said. Really, we're now in a place where we've got the structure in place, so it just means that if there is a potential second wave, we were able to react a lot quicker, a lot more positive. So instead of being reactive, we're more proactive. Like Josh said, we're building the team, including my implementation. We've got 4 more QMOs on their way. So the structure is there, and it just allows us to react a lot quicker and to work with the care homes around COVID-19 concerns and quality assurance.
We've also got a question in the box to Guy. I think you are referring here to the quality assurance team. I'll say it anyway. So he's asked if you could supply the name. Yes, it is. Thanks to Guy. Can we have the name lists of the people in your QA team with titles and responsibilities and contact details? So if you provide those to us, we'll make sure it goes out to everybody that's on the call. Is that okay? Fantastic.
Yeah, what we can always do is also supply our allocation spreadsheet. So each service has a named quality monitoring officer, so that you have a named contact with email addresses. I know that was distributed sort of earlier on in the year when we came into post sort of around January time, but I think what would be useful for you guys is for me to get that shared to you again, so that you've got a name to attach.
Thank you, Josh. There's one other question here. How much support are home care providers getting? The focus seems to be on care homes at the minute, both at a national and local level. And that's Alex that said that. And I would I would echo that, Alex, particularly if you'd look at some of the work around care homes and infection control some month ago or so. So what are your thoughts, Josh and Stephen?
Well, we've largely been focusing across the system. So home care providers, again, if there are particular sort of training needs that you feel that you require, please do get in contact with us, and we can make we can make arrangements and see what support we can provide. In terms of things like PPE, we've been supplying that across the market and across the system, and I think in terms of your named quality monitoring officer, we're able to provide support. So we cover residential, home care, supported living as well, to really be able to provide that tailored response. And ultimately, if you ask us a question and we don't know, we will go away and ask. We will go away and find that for you.
So last question. I think we'll have to make this the last question because obviously we need to move on, but we've got one last question. When are you looking to start the virtual rounds for all of us? So all of those virtual monitoring visits, because I know I did ask a question in the chat box if anybody had had one, but it doesn't look like anyone here has had one, or if they have, they haven't said. But yes, could you give us sort of an idea of when people might look forward to receiving one of these?
So they've been rolled out now currently. So I've undertaken a couple myself to provide that support. Obviously, at the moment, we've got a bit of a backlog because I think it's fair to say that our quality role has had to take a step back. So we're looking to sort of claw more time back to provide those visits. So our main focus at the moment is to catch up with those providers who we've got specific concerns around, or are or have asked for that help. But in the long term, I think particularly with the new workers coming on board, we'll be looking to roll that wider across the market, as we have a smaller allocation pool to work with, and then we're really looking forward to providing that long-term support.
Thanks, Josh. Thank you. Well, I think we need to move on now because, Fran, we really need to get you on as soon as possible. So, Fran, thank you. Firstly, thank you, Josh and Stephen, particularly for the QA update. We've got here. We have received. Sorry, I'll just let you know this. We have received our virtual visit. We found this very helpful, and that's Windmill Care Home, Rollesby. And Lindsay saying, are your vacancies being advertised now? Might know a good candidate. Oh, there you go. We've got some recruitment advice here for you from Lindsay. And Vanessa, and I do apologise, Vanessa, for calling you Sophia, because that's your surname. But anyway, on a real positive for QAs, I really felt supported by the QA during this hard time. So that's all. I think, So thank you very much, guys, and we'll pass over to Fran and look forward to speaking and working with you as we go forward.
Thank you, everyone.
Thank you. Bye. Thank you. So Fran.
Hi, everybody.
Hi.
So,
Hi.
I'm back. I'm back part-time, so I work Wednesday through to Friday most weeks. I'm working today as a bit of a one-off because I didn't want to miss today.
Thank you, Fran.
That's all right. My daughter's at nursery, but my dog is here. So if you hear some barking in the background, really sorry, it's probably the postman coming or something. But I have got some slides to go through. So hopefully everybody can see that. And there's fabulous. There's quite a lot of information here. I've got lots of slides because I wanted to do a really general update of all the stuff Skills for Care's doing at the moment. So apologies if this is a bit quick because I know I'm on a bit of a time limit. So firstly, We've developed a whole suite of webinars to support people during COVID-19. There's a lot which are already available on our website. There's a list here of some of them. They're all short and sharp, so they're a maximum of 30 minutes long, and their focus is on things that people have said they need during the pandemic. So there's stuff around distance recruitment, stuff around effective delegation. There's a new one on HR elements about during COVID recovery phase. So that's what to do if your staff are planning holidays abroad, or if any of your staff are refusing tests, that type of thing. And there's some more coming up as well. So they're all on our website. You can take part in them live. And I know Pete does put information on your e-bulletin for me. But also that they do go on our website straight away after. So there's some really useful things, so do check them out. Verification of expected death with remote clinical support. So we've developed some guidance and resources to support sort of general guidance that's out there. So there's some quite useful pocket cards and an infographic. There's a video for registered managers as well. And there's a lot of information on our website under the end of life care section. I know in Norfolk, I think it might be part of Josh's team actually, there's some training and guidance on the Knowledge Anglia website as well, which looks really good. So do have a look at that, and hopefully people can access the training there. Kate Wyatt is the person who I've been in touch about it. But yeah, there's some useful stuff. We've also put together some bite-sized resources to support a range of areas actually. So one of the ones we brought out is around effective delegation and empowering your staff. Delegation is a really easy thing to talk about and to say we do, but actually in practice it can be quite difficult. So these are sort of pulling all the various guidance that we've got out there into really sort of neat little bite-sized resources. So when you're looking for something in a hurry, it's there. So there's some really useful practical ways to delegate, and then also some stuff to help you think about your delegation responsibilities and how you can do that effectively. It's all in our COVID-19 section. We've also brought some bite-sized resources around effective supervision. So again, this is pulling our general resources into sort of small bite-size, specifically looking at doing supervision virtually. We know quite a lot of managers are doing that, so how you'll be able to do that. And also if you're delegating the supervisor role to others within your organisation to free up your own time as managers, there's some useful resources there that can help. So there's some practical ways, there's some a good recording template available, and what to look for in a good supervisor's checklist. And then there's a link there as well. I think there's also going to be a webinar to support that, so do keep your eyes open. We're aware that you've all been bombarded with guidance and information and advice, so we're quite keen to sort of focus on these bite-sized resources so that you can sort of pick and choose areas that you can. So keep an eye out, and yeah, do ask if you want me to give you any more information on anything. I wanted to remind people that we are the membership organisation for registered managers, and you can join our community for £35 for a year. It's a really good deal actually. You get the handbook, newsletter. There's discounts at our bookshop, although our bookshop does remain closed at the moment. And also we've got a new mentoring and facilitated peer support opportunity. So you can request to get support from a mentor. So that will be a virtual mentor during the pandemic. We found that during the pandemic, actually, that peer support and mentoring has been a real lifeline for some managers, and it can really help sort of promote confidence to take those difficult decisions that you all do. It's a really good service that's available, so do get in touch if you're interested in becoming a mentor or a mentee. And then we've also done, we've got a peer support action learning offer. So these are small groups of about 4 managers who come together using action learning methodology to sort of think about wicked problems. and they're facilitated in small confidential groups, and it's all about that sort of peer support and learning from each other, and it's a great way to work through some of those more challenging problems that people face. We have got groups starting in August, so if you are already a member and you're interested, please do get in touch. And yeah, as I say, the membership, it is only 35 quid a year, and you do get a lot of support with it. As Josh was saying, the COVID time has had a massive impact on people's emotional health and well-being. So I wanted to highlight some of the helplines that are available for managers and their staff. There's Samaritan's helpline, and Hospice UK have got a bereavement and trauma helpline. There's also some really useful apps that have been developed. There's Daylight, there's an app called Sleepio, which is all about sleep improvement program. Now, as I'm sure most people are aware, sleep has a massive impact on our well-being and our health generally. So sort of if you struggle with sleep, and oftentimes the stress in times like the pandemic are very stressful. So yeah, sleep can really be affected. So it's really useful app actually. I'd recommend that one. There's Silverclyde, and then there's also a lot of wellbeing guidance which are on the Care Workforce COVID app, the big the National Care app. So if you haven't already downloaded it, it's worth getting it and having a look. I'm sure many people have started looking into distance recruitment. We've done quite a bit of work around looking at what support people might need around distance recruitment, and we've got some resources looking at the different types of tools that are available to do distance interviewing, so like Teams like we're using today, or Zoom, or some other ones as well I've included on there. And there's some really good tips and guidance around supporting you to do the interview, but also how you can put your candidate at ease with doing it, how to prepare for it, and all that type of thing. So have a look. That's in our Safe and Rapid training element of our website, so do have a look. Some of you might have seen the new Join Social Care platform that's been developed. It's been developed by the Department of Health and Social Care and licensed by Sierra Care. So it's a national platform that aims to accelerate recruitment by making it easier for care providers to reach people in their local area. So it's sort of like a bit of a matchmaking service is the idea. We are promoting it, but Skills for Care haven't been a part of developing the platform at all. And one thing I would say is in Norfolk, you've got so much going on already around recruitment, like at Norfolk Care Careers, the work that Christine and Helen have been doing. So just I would say personally for Norfolk, I think it's probably best to go through the local initiatives that you've got, but I just wanted to point out that this is here should you wish to have a look at it. Some of you might have seen this Care Friends app as well. It's been developed by Neil Eastwood, who's a bit of a recruitment and social care guru really, and we have supported this, and it kind of aims to just formalise the refer a friend process that organisations have. Refer a friends do tend to be the best way to recruit people, and it has that the pilot of this app has shown quite good stats. So interview no-shows drop, workers hired are 20% more likely to reach 3 months. So it's worth having a look at. I think there is a cost attached to it. I'm not sure what that is, but yeah, do have a look. I mean, the recruitment market's changed a lot because of the pandemic. I know a lot of people aren't looking to recruit because they don't want new people in. I know that a lot of people will need to recruit because they need people in, but also people's capacity has changed. There's more people out there looking for jobs now. So the whole market in the space of 6 months has changed phenomenally. So I think recruitment might be a good thing to discuss in future actually. So if anyone has any particular recruitment needs or challenges, please do get in touch. The Workforce Development Fund is now available. I'm sure Christine will talk about this, so I don't want to spend too much time on it. One thing that I did want to point point out is there's enhanced funding for leadership and management qualifications, including some digital modules, which are definitely worth having a look at, because it's a really good deal in terms of cost and what you get back. So yeah, but as I say, I'm sure Christine will talk about that a bit more. We've got the essential training packages that are available as well. These are all delivered by our endorsed training providers. So there's the induction program available for sort of unlimited new workers. There's refresher, and there's also a volunteer program. Have a look on our website for more details. The care certificate. So last year, the department asked us to do some resources which contextualise the care certificate a bit more. So we've done a bit of work around that, and there's some new resources come out specifically for people who are lone workers or dementia and learning disability and mental health. So they have just come out and are available now. And then there's also some which are focusing on autism, community-based working and end-of-life care, which will be available in September. So they just aim to sort of, all the standards remain the same, they're just to support it and sort of contextualise it to the different areas of work that you might be involved in. Digital leaderships and skills. We've got some research that we're undertaking around digital leadership, and we're looking for people to sort of get an idea of how, of what you think really about digital skills, digital leadership, and what support would best help you influence your digital journey in your organisation. So we're looking for people to take part in a short telephone interview or video call. So if it's something that you might be interested in finding out more, then there's a link there to a SurveyMonkey, or just let me know, and yeah, we'll be really pleased to get people on board and involved in it. WhatsApp. So we know that a lot of organisations are using WhatsApp a lot more. For our registered manager networks, we're using WhatsApp to connect people and have those discussions, because we know people needed get in touch with people sort of there and then. And WhatsApp's a really good resource to do that. So we've developed a guide on using WhatsApp. So that's available to download, and just gives an information about what it can do and sort of the safety of it and all that type of thing. So yeah, if you are thinking about using WhatsApp, it might be quite useful. Excuse me. Nurse deployment. So it's just a bit of a reminder really that our website is the place to go for the most up-to-date information on how we make sure your need for a nurse is recorded. So that links with the NHS Capacity Planner, and so there is the Return to Nursing, which has been linked through that. So there's a whole load of resources which have been put on the website, including a flowchart of the process. There's also some characteristics of a social care nurse, which are quite useful, and it's all in the nurse deployment section. And then finally, our size and structure report has just been published. So please, yeah, download it. Okay, and that's me.
Sorry, thank you so much, Fran, and you've managed to get through all that material in your time, so thank you very, very much. Fran, I've got some questions. I've got some questions for you, so I'll go back to, we'll ask them to you. So firstly, just to say that we got some feedback around the HR webinar yesterday. Helen attended and said that was really good. Lindsay said that she's attended a few webinars and they've been very good as well. Just a question for me, Fran. You know the cards that are available to support the verification of death? I think you were talking about some of the resources. Are they free or are they costed?
I will check. I think they're free, but
okay. If you could check, that'd be really useful. Thank you. Anne and Susan mentioned here that more and more clinical tasks are being expected in care homes, and also I think as well within domiciliary care as well. Obviously, a lot of that has increased during the pandemic, but they were asking where will the support come if things go wrong. And Lindsay responded by saying the QA team will support as well, and the nursing, the quality improvement nurses as well. And again, just I would add that if you think of anything specific that you have a concern about, it'd be really useful for us to know at Norfolk and Suffolk Care Support, because we can raise that as an issue with our CCG colleagues and make sure that we look at that in a bit more detail. We got a question, Fran, from Lorraine here, who says, can you join the registered managers membership if you're not a registered manager, but you're going to become one to get the mentoring and guidance? So, Fran, I think you're on mute.
Oh, sorry. Yes,
That's all right,
me
Fran.
chatting away.
Oh.
Yes, get in touch with me and I can give you specific details. If you're going to become registered, then yeah, we would get you to become a member. Yeah.
Oh, that's brilliant, Fran. Thank you. And Helen has said thank you for highlighting the Norfolk Care careers as well.
You're welcome, Helen.
We've spent quite a lot of time, improving the site and getting the footfall. So that's really helpful. So thank you.
Yeah, it's a fabulous service compared to the rest of the country. Norfolk are really lucky to have it. So yeah, it's great. Do check it out.
Fantastic. Thank you, Fran. Thank you. Okay, so I'll just leave it for another 30 seconds in case there's anything else that anybody wants to bring up. Any news on apprenticeship opportunities now? Sunita, do you want to just take your microphone off and just ask us in what context do you mean?
I think the government has announced for taking the new carers now from 1st of August till January coming between the age groups. And is the Skills for Care going to support that for? And where will the funding be coming from, or is that separate pot of money?
So, Sunita, I can answer a little bit of this. So, the apprenticeship funding will come from central governments. So that will come out of your levy. If you haven't got a levy, you can transfer levy. So there are opportunities there. You can also co-fund it if you wish as well. But there are also incentives that the government have introduced, which is age range, additional amounts if you employ apprenticeships in certain ages. Now that we've sent out through our e-bulletin. Also, Norfolk County Council have got some additional grants as well, which are around the recruitment of apprenticeships as well. We'll be putting all the information in our newsletter as well, Sunita. So all the details of that will be in the newsletter. But there are sort of three main areas. One is your funding, your levy funding through the government. Another is this additional funding from age, which again is through the apprenticeship funding. And the third one is through the County Council for additional incentive grants. Fran, was there anything else you wanted to add to that?
No, that's yeah, perfect.
Okay. Oh, we've got a few hands up. Raj, would you like to go? I'll mute myself.
Yes. Okay, Christine. Thank you. Again, on the subject of the apprenticeship opportunities, do you have any people who are looking for that kind of things? Because I do have a vacancy and I don't mind. I've done it in past, so I don't mind doing again. Yeah. It has to be over 18 though. Yes. Okay.
Okay, so you've got an apprenticeship that you want to advertise. You can put that. Helen, can you come in here and remind me, are you allowing apprenticeships to be advertised on Norfolk Care Careers?
Yes, absolutely. We have actually advertised some recruitment of apprentices, not care at the moment. We've done business ones for a care home, but yeah, absolutely.
Is that okay, Raj?
Yes, that's fine. No, I think I'm gonna try that. Yeah, so I'll be in touch with Helen's sometime.
Yeah, and
Okay.
Raj,
Different ways and means.
yeah, exactly. And Raj, if you've got an apprenticeship vacancy, particularly around a particular area, we can also contact the colleges that may have students that would be looking as well. So
Okay.
there's more than one way, to get your your response. Is that
Right.
okay, Raj?
Yes, thank you very much, Christine. Many thanks.
Pleasure.
Yeah.
Okay, so I'm now going to come in here, and I'm going to put my little presentation on now. So if I just share this, I'm just going to go through. Oh, sorry. Whilst answering those questions and asking them, there's another couple that come in through the chat box. So Anne, verifying death, oh, here we go, has gone from being a doctor's responsibility to nurses, yet we're now expected to do this with no medical background. Right, okay, so I think the point about this, and it is something that has been raised, Anne, by other managers as well, is that I suppose it's about trying to work out what the best way of managing this situation is before, because some care homes have reported that they would prefer to be able to do this where others haven't. So I do think there's a little bit about some people feel confident about this and others do not. I would suggest that you work with the quality improvement nurses, particularly in your area, and if you want more support, more connections with those, very happy to do that outside this meeting, and very happy to try and support. Is that okay? And in the meantime, I'm going to try and share my screen here and just go through the last bits of my presentation. I hope I've got the right one coming up now. You'll have to tell me. Has something come up yet? No, it's the wrong one. Let me just.
Hi everyone, I'm not sure if Christine has actually accidentally left the chat.
Sorry, no, I'm back.
She's back. She's back. Okay,
I
will mute myself again.
Sorry, it's really difficult managing everything and sharing a presentation. It would be helpful if someone else could have done it, but never mind. I'll go back and see if I can find it again and get that up. So that we can go through the updates. There we go. Let's see if we can get that up now. Bear with me. I had it earlier, but unfortunately, when I came out of that, it came down. There we go. Right. Open. Right. Here we go. Right. I'll come back on here. Share my screen. There. Hopefully. Can everyone see that now?
That's perfect, Christine.
Yeah,
thank you.
Yep.
Thank you very much. Well, I'm just going to go through a very quick update of some of the things that Norfolk and Suffolk Care Support are doing at the moment. So just to raise your awareness, there is some training going on signs of deterioration. Now, most of the sessions for staff have now been completed. There is an extra one on the 10th of September, but there's very limited time left to put your names forward. So that's for staff. However, there are 4 more manager sessions that are going to be announced through September, and we're hoping that we'll get those out in the next week or 2. So there'll be 4 manager sessions, and you'll see they'll cover all sorts of things around being unwell, the deterioration, how to escalate and how to get the right help. and they have been proving extremely well received. We've also got the virtual respect training sessions that are being run by Kate Wyatt. Now, due to popular demand, all the top ones have all been snapped up. So we have got November and December dates left, and she is hoping to put on some more training sessions. So if you haven't done so, please, I recommend you get involved in that and your staff involved in that. Wellbeing resources now, Fran mentioned about wellbeing in her presentation, and just so that everyone's aware, we've collated a lot of the information together on our website so that people can find out where that material is and support. So there's wellbeing for care staff, wellbeing for managers, and wellbeing for service users. And I've done a little picture so that you can see it's under useful resources. So at the top of the screen, you'll see a grey bar saying useful resources, or tab should I say, and it's under there, and you can find all sorts of fantastic resources there. We also are running some registered manager virtual meetings. As you know, we've held registered manager meetings for some time now, and we put those virtually so that we could still meet with people. We're doing it slightly more regularly, but with a wider group. We've held some very interesting and very well attended virtual meetings, and we'll continue to advertise these in our e-bulletin. The next one is going to be on Wednesday the 26th of August, and we've got a speech and language therapist coming along to talk about what they're doing, but also we want to do a review and feedback on the social care workforce strategy. And here are some of the things that we regularly do. So for those that know us very well, you'll receive, well, everyone will receive our e-bulletins. People will look at those when they need the information, but what we try and do is we put a little reminder of an update that's gone on to the Norfolk County Council website on guidance, and we'll put anything on learning and development or anything that we think would be useful to you on the e-bulletins. And then what we'll do is we'll upload them onto our website under news. So if you want to go back and check to see any e-bulletins or newsletters, then you can find them there on our website. Similarly with newsletters, we send those out every 4 months, and our next newsletter is due to come out very shortly. So that will contain a range of different articles about social care and keep everybody up to date with what's going on. But just to remind you that in the e-bulletins, and we'll mention it again in the newsletter, is that Norfolk County Council have got a site for care providers specifically that updates the guidance. And what we do is we link to that, and we've worked with Norfolk County Council to improve that site so that every tab on there, say letters or PPE, will have a date when it was last updated, rather than you having to scroll through all the information. Workforce Development Fund, which Fran mentioned just earlier on, there was a delay in providing the funding because Skills for Care had to make some difficult decisions with the Department of Health and Social Care about how that funding was distributed. But we have got some funding for the rest of the year, which is similar to how it was distributed last year. So you won't have to do parts of qualifications. It will be paid out on a certificate, and there are priorities there, as Fran has mentioned, around leadership and some of those well-led courses, Lead to Succeed and so on. All of the courses will be on our website, so there will be a list of qualifications that are on there, so you can check those. But if you have any queries, you can always contact Katie or Pete or any of us in Norfolk and Suffolk Care Support for further information. The forms are...
Christine, I was going to say, can I just say the workforce development funding page of our website is now up to date with all the forms and the guidance and the list of funding qualifications. So it is all there as of this morning.
Fantastic. Thank you, Pete. Thank you. That was one of the issues. We were waiting for some documents, but they're all uploaded now onto the website. So those that have got certificates for this year can start putting them through. Thanks. The workforce survey, just a heads up, a social care workforce strategy has been collated and written. And what we want to do is we want to go out to everybody in the social care sector for some feedback on that. So the next registered managers meeting, we will be discussing that, but we'll also be sending a survey out to you and also possibly contacting you by telephone as well to get some feedback, and we'll talk you through a survey on the telephone. And that's really important for us because of future workforce planning. Finally, just a couple of things just to draw your attention to. We do have a Facebook page, but we are considering setting up a WhatsApp page. So we will be using, Fran, your information from Skills for Care on setting up a WhatsApp page, which is very useful, and we'll possibly be looking at that in the future. But what I wanted to do is possibly ask providers today that hear managers today, just in the chat box, to say if they would prefer or would like a WhatsApp page to be set up. So if you could just say yes, please, WhatsApp or whatever, that would be useful. Thank you, just to get some feedback on that. And the last thing is for care homes, we've sent out an email on behalf of the CCG raising the importance of the shared NHS net email account. It was previously referred to as a generic mailbox, GM. And the importance of this is because we want to make sure that the GPs and all the affiliated professional support gets access to your home and you get access to them. So we've sent the email around. Please read it. Some people thought they'd signed up and they probably had, but they haven't kept it active or they haven't activated the account. So any queries, there is an email to get back, which is in our e-bulletin. But if you have any queries, please do come back to us and we'll point you in the right direction about that. So those are really the updates from us. I just wanted to say thank you for listening and participating. I will have to come out of this and then just check the chat box to make sure there aren't any questions I need to answer before going. But just please complete the little Survey Monkey evaluation. That would be great for us. So thanks ever so much in advance for that. And just to remind you that our next care provider meeting will be on Tuesday the 24th, and we're going to do it like this again simply because we don't know yet about the face-to-face meetings, and we think for this year it's beneficial to do it like this. So I'm now going to come out